Public health officials across Ontario, Manitoba, and Quebec are all reporting a rise in the cases of invasive meningococcal disease, which can lead to meningitis. So far, in 2024, Toronto Public Health has logged 13 cases. That's the highest the city has seen since 2002. And while the disease has the potential to be deadly, infection is still relatively rare, especially if you're vaccinated. For more on what you need to know to protect yourself and to recognize the signs of infection, we're joined by infectious disease physician Dr. Isaac Bogosh. Welcome back.
Great to see you, Anne-Marie.
Okay, first of all, can you tell us the difference between bacterial and viral meningitis?
Absolutely, and that's a great place to start. When we think about meningitis, that means inflammation of the lining around the brain and the spinal cord. There's lots of different ways to get that. There's infectious and non-infectious causes of this, and under the infectious umbrella of meningitis, you can have viral, you can have bacterial, you can have other pathogens as well, fungal, for example. But bacterial meningitis is a very severe syndrome. Many people are already aware of it. It can cause fevers, terrible headaches, very severe illness, and it has to be treated promptly.
How does the disease spread?
Bacterial meningitis is spread typically from prolonged close contact with somebody who has this infection. So it's in respiratory secretions, and if you are a close contact of someone who has this or who has this infection, you might be more at risk of getting this. So typical risk factors for this include university dormitories, military barracks, occasionally sports teams, any congregate care settings or settings where there's a lot of people in close contact with one another.
Why are we seeing a rise in cases? What's going on?
Hard to know. It is hard to know, and I think we have to have, there's some uncertainty there. One thought is that, of course, during the toughest times of the pandemic, we certainly saw other public health programs take a back seat because all efforts were focused on combating COVID-19. That might be one reason. There's probably other reasons for this as well, but I think that's still an unknown right now.
So what do symptoms look like? And, if people haven't had this experience in their households, what do they look like? How long does it last? And how do you treat it?
Yeah, so this is a pretty rapidly progressing illness, and it's a very severe infection. People will present with headaches, sometimes neck stiffness, fever, but people get very, very sick very, very quickly. This isn't one of those things where you think to yourself, should I just wait a day or two before I go in? It's obvious that someone is sick enough to go in to seek medical care. And in fact, if you look at some of the data, the timing from symptom onset to people actually seeking care in a hospital setting, it's typically less than 24 hours. So it's pretty clear that someone's very ill, and it's treated with conventional antibiotics. Now, if people seek care and start antibiotics quickly enough, they can make a full recovery. The issue is with delayed care or delayed initiation of antibiotics, you can have very significant complications, seizures, coma, and sadly death.
All right, Dr. Bogosh, great to have you here. We're hearing a lot about it in the news, so we appreciate you providing us some answers and some context.
My pleasure.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.